As technology progresses, it enables societies to advance. But innovations need to be understood and trusted and lift us all. In AI, medical, space, climate, technology unlocks human potential. And rules we design today are as important as the technology we create. It's how business delivers technology safely into our hands, and how countries leverage innovation. This partnership between transformative technology and purposeful policy drives growth, ensures investment, builds better societies, and powers human progress. We make innovation work for the world.
Well, hello and welcome to everyone watching. I'm Patricia Wu and I'm Senior Vice President at Access Partnership. I'm also honored to serve as chair of the America's Business Dialogue Health Working Group. This is an initiative facilitated by the Inter-American Development Bank, where we work with governments to promote policies in support of sustainable and inclusive growth. I am delighted to have with me today Sarah Aiosa. Sarah leads the Human Health Division at Merck, known as MSD, outside of the United States and Canada for Latin America. In this role, Sarah oversees nearly 5,000 people in more than 30 markets. She is the first woman president in MSD's history to lead this region, the Latin America region. She holds a master's degree in public health, and she is currently chair of the board of directors of the Latin American Federation of the Pharmaceutical Industry, FIPharma. No wonder Sarah was named one of the 50 most powerful Latinas. You go, girl. A fun fact about Sarah is she began her career in the health sector when she was 14, working in her local neighborhood pharmacy. Welcome, Sarah. Thank you for joining us.
Thank you so much, Patty, and thanks to the Access Partnership for organizing this really important discussion on America's Rise for Health and for giving me the opportunity to share some perspectives. And thanks to all of everyone who's joining us today.
Well, Sarah, I'd love to maybe start with the why. Why are we here having this conversation? Why are you taking time out of your busy schedule to talk about America's Rise for Health, RISE for short, this really special public-private platform that's building sustainable health economies for the region? Over to you.
Thank you. So as you know, Latin America is a dynamic and fast-paced region where really health affects the economic and social progress of over 650 million people. This population, added to the US and Canada, totals more than 1 billion people in the hemisphere. In our hemisphere, 3 countries, that's US, Brazil, and Canada, are among the top 10 economies globally. So the impact of investment in health really takes on a global scale. And we believe that investing in health systems helps to protect society and boost the economy, because a healthy society is a more productive one. We say health as well. And we really learned that through COVID, right? That there was an increased recognition from government stakeholders of the importance of having health systems that can both manage and navigate health emergencies, but also routine care. And there's been good progress in recent years, as you know, but we really still have a long way to go in improving healthcare in our hemisphere.
Yeah, no, I think, Sarah, that's absolutely right. The region chronically underprioritized and underinvested in health. Public health spending as a percentage of GDP of only 3.5% versus 6.6%, 2 times as much for OECD countries. And that translates into half as many doctors, less than half as many hospital beds. And so it was unfortunately no wonder that the region was harder hit by the pandemic. 3 out of 5 countries with the highest mortality rates were in Latin America. You talked about how health boosts the economy, and of course, that's really key to our discussion today. I think we all know that healthier populations means healthier workers, more productivity, better economic outcomes. But I think what maybe is less appreciated is how health can be a strategic economic asset. And by that, I mean a driver of jobs, investment, exports. I'm always struck how in Germany, the health economy is 17% of the labor force there. That's a lot of jobs. But in many Latin American countries, that number is closer to 6%. So there's a huge upside here. There's 3 times as many jobs that could be created if we try to reach Germany's levels, if we can get the policy environment right in Latin America. And if we do so, we can attract more global health investment. And I think, as you and I have talked a lot about, the time is now. Supply chains in strategic sectors, especially medical products, are shifting because everyone is appreciating that we need more resiliency.
Patty, I totally agree. I don't know if you're aware, but there was a recent IQVIA report, and it tells us that for every US dollar that's produced by our pharmaceutical industry, an additional 70 cents are being produced in other parts of the economy in Latin America. So for every job created, that's nearly 2 additional jobs that are created elsewhere. And this means that our pharmaceutical industry disproportionately contributes to improving the quality of life and consumption in the economy relative to its direct employment. So as I think about Latin America, I'm so excited because it's an attractive region full of opportunities to increase research and development investments. And like you said, we really just need those enabling conditions to both attract but also maintain that investment.
So Sarah, where do we start? How do we get those enabling conditions?
So it's a great question. I think we need to really start in thinking about 3 key ways that personally I consider the most pressing, and when there are these opportunities to produce not only a positive, but a lasting impact. So the first would be prioritizing health as an investment. Seems obvious, right? Addressing regulatory bottlenecks through reliance would be the second point. And then the third would be to continue to foster innovation and broaden access.
Thank you. That's a lot of work to do. I know we talked already a little bit about prioritizing health as an investment at the outset, but tell us more. What else do we need to do here?
So I think there's certain ways that we can continue to collaborate together to prioritize health as an investment. And we really need to work on increasing funding and financing in health. You mentioned, right, that the OECD recommends a minimum of about 6% of the GDP investment in health. I think if you look also at the Pan American Health Organization, they recommend that our countries invest a minimum of 30% of the healthcare budget to that first level of care. So these are some ways, right? Seems obvious to increase funding. But we also need to ensure the right health for all and leverage new care models, really take advantage of the advances in digital health and technology, of course, to ensure equity. And this is really alarming, actually, when you think about non-communicable diseases such as diabetes, cancer, heart disease, all of which are unfortunately on the rise. In the Americas, NCDs, or non-communicable diseases, they're responsible, not sure if you know, Patty, but for nearly 6 million deaths each year. And if we were only to intervene, right, we can make this a better picture. The World Health Organization, or the WHO, has these best buy recommendations for these types of diseases, which include preventive care, such as reducing the use of tobacco, cancer screening, better diet and exercise. And I just think if G20 governments were to implement even a few of these best buy recommendations, what a difference we could make. We could avert an estimated 39 million deaths and generate nearly $3 trillion in economic benefits. So the bottom line, there's a big opportunity to increase health financing. We have to do it smartly, investing where it's most needed.
Yeah, no, I think that's right, Sarah. I think if we can hit those targets, then perhaps, and I think we all know when we have our next pandemic, hopefully Latin America will not be the laggard, but be in a much stronger position and much more resilient. The second item you recommended, Sarah, is around regulatory bottlenecks. How do we overcome those bottlenecks?
It's a great question. For starters, I think one key challenge in our region is the lack of a central regulatory body in the Americas. Unlike the US that has the FDA and Europe that has the Central European Medicines Agency, both of which have really high standards, Latin America does not have that. So in the absence of the central body, the way that we typically address bottlenecks is through a mechanism called reliance. And regulatory reliance occurs when a national agency, a national regulatory authority in one country will consider and give weight to the assessment performed by another authority or a trusted institution in another country to help it reach its own decision. And this approach to trust and rely on the work undertaken by respected agencies in other countries is really efficient. It allows the acceleration of innovative medicines and vaccines. And we learned this, how important it was to share for efficiency and to move quickly. We learned all this through the pandemic. For example, when we shared pharmacovigilance data and monitoring and surveillance among all the countries. So unfortunately, about 1/3 of these national regulatory agencies globally have the right capacity. Primarily, they lack human resources or financial resources. And unfortunately, only 13 of 20 regulators within Latin America directly recognize or abbreviate their own marketing authorization process in case of earlier approval by another jurisdiction. The regulators that are most relied on are, as I mentioned, EMA, the FDA, and Health Canada. But I want to give you a really positive example. We have a mechanism called Project Orbis. It's an initiative of the Oncology Center of Excellence, which is part of the US FDA. And it's a great example of using regulatory reliance to improve oncology drugs, cancer drugs, for patients in the world. And in the Americas, the regulatory agency in Brazil called Anvisa is one of the 7 partners that currently collaborate with the US FDA. We have seen amazing results of fast, innovative approvals in oncology in Brazil. So if our regulatory bodies would trust and rely on each other, we can really bridge these gaps and improve access to safe and effective innovation much more quickly. This speed is fundamental because it allows patients to reach care faster.
Well, Sarah, I'm a mom of 3. I know you're a mom too, and I am all about relying on my trusted friends and neighbors as I have limited capacity. So what you just described makes perfect sense. But back to your recommendations. I think the last one was around fostering innovation and access. Tell us more.
So thank you. And yes, as a mom of 3, we must trust and rely on many people. So if you'll allow me though, first, let me provide some context. Our company, MSD, has been operating in Latin America for nearly 100 years. And we have a vision to transform healthcare in LATAM so people can live better lives. We do this by ensuring patients have access to important medicines and vaccines, and also through investing in research and development. Since about 2000, companies like ours have invested more than $1 trillion globally in the search for innovation in medicines and vaccines, looking for treatments and cures. And in general, our industry engages in the most risky and costly part of scientific discovery. That includes extensive clinical trial programs to establish the safety and efficacy of these products. We know on average it takes a decade and more than or nearly $3 billion to develop a new drug. And often companies like ours undertake and invest in this work to make advances in science with the risk that research may not always result in commercially available drugs. In fact, did you know that in the US, over 90% of the time, these programs do not result in FDA-approved products? So innovative therapies developed by our industry really have helped to substantially improve the quality of life for millions of people globally. It's something that makes me really proud to work in this company, but also across the industry.
Yeah, no, I'm so glad you mentioned that, Sarah, because I think we all experienced that personally. I'm actually just about to go back and get my 3rd and final dose of the HPV vaccine, which prevents cervical cancer. And when I was a kid, this vaccine did not exist. And now, thanks to innovation from companies like yours and others, it's incredible to think that we're actually on the cusp of a world that can imagine the elimination of cervical cancer. Just really, really incredible, the power of innovation. But something that in doing this work and observing the region, and you talked a little bit about this. While here in the United States, I'm sitting here in Washington D.C. I can access new vaccines, treatments, cures, but access remains a challenge in Latin America, right?
Absolutely, and also in US as well. By the way, you just reminded me I have to schedule my daughter's second dose of that vaccine, so thanks for the reminder. But yes, unfortunately, we think about these access challenges in Latin America, and all this great innovation will really only bring benefit if patients can actually access the innovation. There was a recent report released by PhIPharma, the weight indicator, that highlights these disparities that we're seeing across countries in Latin America. And it reveals that the average waiting time from FDA approval to effective availability for patients in Latin America ranges from nearly 2 to over 4.5 years. It's kind of shocking. So just to give you an example, if there was a drug, a cancer treatment that received approval in the US in February of this year, maybe the earliest it could be available in some of the Latin America countries would be the second half of 2028. And we need to do better than that, right? The study shows that out of 228 drugs approved by EMA and the FDA, only 130 have regulatory approval in at least one country in Latin America. And only 86 have broad availability in at least one of the countries that were studied. So it's so important that we continue to collaborate across all sectors to improve access for patients. And you mentioned it before, there's a lot of work to do in Latin America, but I'm optimistic if we can get the conditions right. And that's why I'm so excited about the America's Rise for Health platform that we've been working on together, not just together, but with other organizations. We realize we really need to roll up our sleeves and do more.
Yeah, no, it's very exciting, and we've loved working with you and so many amazing partners to stand up America's Rise for Health, because the people of the Americas, they deserve not to wait 4.5 years for innovation that impacts their lives, but they really deserve resilient, inclusive, sustainable, and equitable, RISE, health economies that work for them. And I think what's really been eye-opening for us as we've been doing this work is, as you've been describing, Sarah, for each of these issues, those 3 issues that you laid out, those are not issues that a Ministry of Health can tackle on its own, right? So the first one you talked about, sufficient health financing, you need finance ministries at the table, because obviously they are the ones who ultimately have the purse strings. The second item that you talked about on the regulatory bottlenecks, you certainly need the regulators at the table, but as we've, what's perhaps less known is when you have these unnecessary regulatory barriers or burdens, they really become a trade barrier as well. And so that's where your trade ministries, I think, need to be involved. And then finally, you talked about kind of valuing innovation and really making sure that you have the enabling conditions that kind of appreciate that lead time, and that 90% of that research doesn't ultimately make it. How do you ensure that you have governments that are embracing that kind of innovation life cycle? That requires ministries of commerce, investment, innovation, science. So it's really this whole of government approach. It's not just ministries of health. And from the private sector side, what's been really fun is, you see that this is not just about biopharmaceutical companies, although they're of course a huge piece of it, but it's also medical device companies. They're the ones who can screen for cervical cancer, for example, breast cancer. It's logistics companies. During COVID, it was companies like UPS and others that actually got the vaccines. And of course, we don't remember what the cold storage requirements, but are able to get them shipped to the airports across Latin America and then distributed. It's also the insurers. It's digital health companies. It's been fascinating to learn with the pandemic how the critical role that telemedicine played, so that we could avoid unnecessary emergency room visits and limit the spread of COVID. But also telemedicine rests on interoperability. It rests on a cloud-based environment that enables that digitalization. So you really kind of need private sector, that entire private sector at the table. And of course, those are big companies, but also small companies, because, and I think this is perhaps something that's less well known, but a lot of the innovation comes from smaller companies that ultimately partner with larger companies like MSD. But also civil society is key to this. And we're really fortunate in America's Rise for Health to have some great civil society partners, because they're the ones who are bringing the voice of patients and of people to ensure that what we're talking about, but more importantly, what we're doing is inclusive of minority groups, of vulnerable populations, and that community voices aren't left behind. I know, Sarah, you and I, we've been really, really fortunate to stand up America's Rise for Health with a key leader and champion in the U.S. government. And I think we've been really fortunate that they have recognized, in particular, the U.S. Department of Commerce and the Department of Health and Human Services, that this is needed. And we as private sector, we can't convene that on our own. You really need the power of government to kind of bring everyone around the table. And they really did so in announcing RISE alongside the 9th Summit of the Americas that the United States government hosted in 2022 in Los Angeles. But I think what's terrific is that there's recognition that we really, it's a partnership that is required to stand up a platform like this. And I've been really honored to serve on the steering group representing private sector alongside the governments of the United States, of Panama, Uruguay, Costa Rica, Dominican Republic. And we had our first meeting in March 2023 in Panama City. And of course, you were with us at RISE 2 just this past March in Punta Cana. So we're 2 years old, right?
Exactly. No, thanks, Patty. And that's exactly right. And I really echo everything you just said. I also actually really enjoyed attending both last year's gathering, and this year was my first time in Punta Cana. But the second annual RISE meeting was, I think, extra special because we had with us Diane Farrell, the Deputy Undersecretary for International Trade for the U.S., for the United States. And as you mentioned, really having that U.S. Government backing for this initiative is so critical. We also welcomed government representation. I think we had 13 countries, if memory serves. And we also had multiple regional partners, including the Pan American Health Organization, as well as the Inter-American Development Bank. And there were about 40 private sector companies and civil society organizations. I was so thrilled to see the high level of engagement from all of us in the room, from different governments, from all different types of organizations, companies large and small, as you mentioned, with that willingness, that commitment to engage, to discuss these challenging issues, but importantly, to find concrete solutions. And like the first annual meeting that happened last year, our second one, you'll remember, we produced a consensus statement. And this was really powerful because it was a voluntary acknowledgement by all of us in attendance. And we walked away with 6 clear pillars and concrete action for each of them. They include trade and investment, regulatory improvements, health financing, ethics, equity and inclusivity, and of course, digital health. That's an incredible accomplishment for only 2 years of existence. And we really look forward to seeing how RISE will rise in the coming years. So next year, I think it's Santiago, Chile.
Yes, on to Santiago, Chile. And I think you're right, Sarah. It's really important that we continue to emphasize delivering results year after year. I mean, it's important to discuss, but we also really want to roll up our sleeves and get done the multisectoral collaborations, these projects, these meaty projects that are really needed on a public-private basis. The pillar work streams, I think, as you mentioned, have been just this terrific space where at the working level, you've got government officials, private sector experts, civil society leaders. We can really go deep. We can really brainstorm, share but ultimately vote on and select consensus-based concrete projects to work on together. And as you said, it's been really exciting to see that we've been able to agree on so much. So some of the projects that we are working on, one, developing a primer on innovative health financing mechanisms to address the most urgent need that you talked about, sufficient health financing. So obviously we need more public health financing, but also what are some of the innovative health financing mechanisms that can be brought to bear so we have that sufficient fiscal space. Second is establishing a RISE network for regulatory capacity building. You talked about those regulatory bottlenecks, and we can't have people waiting over 4 years for a medicine for treatment. And we've got our first in-person course. The plans are to have that held in August in Mexico City. Capacity building training for procurement officials. So much of health runs through procurement. And there's just so much opportunity with values-based procurement to really make sure that the right investments are made and that we're spending in a smart way. And then also expanding the number of health ethics frameworks. I think we all want to make sure that the environment we're operating is an ethical one with patients and the benefit of patients at its core. So expanding those that kind of ethical frameworks. And then finally on digital health, we heard that when there's different nomenclature, different words, then that really becomes a barrier to the adoption of digital health. And so bringing everyone around the table to come up with some of the common nomenclature, common verbiage, common words, so that we can really accelerate digital health adoption. So some really, really concrete, meaty projects. Sarah, I'm curious, which ones are you the most excited about?
Thanks for the question. So I'm clearly excited about all of them. They're all really, really important initiatives. But if I had to pick, right, we spoke earlier about the need to invest more in health, and as well as innovation and broadening access for patients. So with all of that said, I think the health financing pillar and the digital health pillar are the two that you mentioned that resonate most from a business perspective. So just to give you an example, right, we know that Latin America and the Caribbean remains one of the most inequitable regions in the world. I think it's nearly 30% of the population live below the poverty line. And about 30% of the population do not have access to healthcare for financial reasons. And about 21% of the population aren't able to seek healthcare due to geographical barriers, right? So having innovative financing mechanisms offers a way to support the traditional care models, but also to increase access to health services and technologies. I think you mentioned telemedicine earlier, right? And they really ease the burden of cost for individuals and communities within the region. So it's great to have the IDB at the table, identifying partners like the World Bank, exploring innovative health financing through other pilots and partnerships. They'll really foster the opportunity for all of us to learn about the options available, especially governments, right, that can help support increased financing and increased access in these countries. On digital health, I have a dream. My dream is to have fully safe, private, totally portable electronic medical records that follow a patient through their life from birth to the end of care in every country. So that's the dream. But, we really have much to address to make that dream a reality. So for starters, that handbook that you mentioned earlier, just to have that common language, that common nomenclature around digital health and policies will really allow all of us, governments, private sector, civil society, healthcare providers, everyone to really speak a common language. And we at MSD are really proud to be an active participant in these concrete building projects, capacity building projects, and engage every year through our RISE meetings. I really strongly believe, Patty, that together we need all of us at the table to trust and rely on each other to make a difference.
This has really been exciting, and I could not agree with you more. But Sarah, in creating something new like this, it really takes leadership. And, doing something new like America's Rise for Health, it can be hard. There can be naysayers. It takes time. It takes patience. It takes a lot of listening. What motivates you to lead? And I'd really kind of like to end on this and then open it up to questions from the group. But, ending on a more personal note, what motivates you to lead? What is your vision when it comes to leading to build stronger healthcare systems?
Thank you for the question. So if I reflect back to my earlier life, and you mentioned it, right? My first job was a part-time job after school, working at a local neighborhood pharmacy when I was a teenager. And I had to often play the role of translator. It was a Hispanic neighborhood. And luckily, I'm fortunate to understand and speak Spanglish, so I could serve as that role of translator. But something was really clear to me when customers or patients would come in and they needed help, right? Is that, how important it is to be able to communicate your needs and to be able to have them met. It's just such an important part of health and society. And look, when we share the same goals, we can all benefit and produce better health outcomes. So that was one key learning. That's my why, but also just the collaboration, right? The collaboration that's required from all stakeholders in a community to make it better. And that really inspires me. So it's what kind of, as I reflect on when joining RISE, drives my commitment, my personal commitment, my passion for public health. You mentioned that I have a public health degree. I actually studied underserved patients from underserved populations in cancer clinical trials. And so that's an example, right? There's so much inequity in health. So we all have to work together across stakeholders, and especially in a hemisphere like this, where people deserve better. So it's really exciting to be gathered here toward these common goals and recognizing that we all have a role to play, regardless of whether we're in the private sector, we work in government, we work in academia, civil society, regardless of industry. You mentioned, shipping, logistics, digital, transportation, consumer, telecoms, energy, food. This is all part of the fabric of our Americas. So together, we really can build resilient, inclusive, sustainable, and equitable health systems. Thank you so much, Patty, and the America's Business Dialogue. I mean, your unwavering commitment, your leadership, your partnership, you really are helping us to materialize these dreams. Thank you.
Well, thanks, Sarah. It's work that I know you and I and our colleagues and team. It's for exactly the reasons that you articulated. It's meaningful, and we wouldn't want to be anywhere else. Well, thank you. I think you have just done a terrific job in explaining kind of just the amount of work that needs to be done, the opportunity that's in front of us for Latin America. And how we are together, working with great partners, and now have a platform to methodically, collaboratively, really help get the Americas kind of the health economies that it deserves. I think with that, we have some time for questions from our audience. And so I'm told that magically some questions will emerge. Okay, perfect. So the first question that I'm seeing here, Sarah, is what is the best manner to achieve regional or local public-private collaborative schemes to enhance a trusted partnership between governments and industry?
It's a great question. So I think, maybe I'll start, Patty, and of course, you're welcome to comment. It's the theme of this discussion, right? It's really bringing all the stakeholders together and trying to have an open and productive dialogue. I think that's the way, getting all the stakeholders, regardless of the sectors, locally, can start locally, and then obviously at a national level, depending on the country and the government structure, including legislative colleagues as well, looking at the policy framework. So having that open and productive dialogue. And obviously data also helps. If we mentioned a few studies together in our conversation today, but obviously having those surveys, that data, that evidence to show where the gaps are, and then really working together to close them and bridge them. What are your thoughts, Patty?
Yeah, I totally agree. I think two more pieces I would add. One is, it's not going to, when you have so many stakeholders together, we're not always going to agree on everything, and we're not necessarily going to be able to work on everything. So I think it's always also important to be very transparent and forthcoming about where there's areas where we're not ready to agree yet. And so let's put those to side, let's park them, but then let's focus on the areas where we do have shared interests, like digital health, like regulatory improvements, like health financing. So, let's not get stuck on things that, we can't agree on. Let's focus on the immense amount of work that we can agree on that needs to be done. I think sometimes, unfortunately, we kind of get stuck on the things that we can't agree on. But again, there's just so much for us to do together. So that's one. I think the second piece is, and I think you touched on this, which is you have to have a dialogue. You have to be able to have a space where you can have the conversation, where you can share the data. And so if there isn't even the space, then it becomes very challenging then to find solutions, right? I think the best solutions are the ones that are informed by multiple perspectives. That's how we can get to the most workable solutions. And so I think America's Rise for Health really tries to focus on providing that space, and then also focusing on the things that we can, the work that we can agree that we need to do together. If no other thoughts, maybe we can see if magically a second question will appear. Here we go. Question: are there aspects of the America's Rise for Health platform that differentiate it from other initiatives?
It's a great question, Patty. Actually, maybe you might be in the position to answer that, because I believe you started APEC, right? And that might be one for comparison.
Yeah. No, so I think in some ways it was inspired by a really terrific model that some of us saw in Asia Pacific. So in the Asia Pacific Economic Cooperation Forum, or APEC, there's 21 member governments, but it's one that is very inclusive of the private sector. In fact, it has a formal body, the APEC Business Advisory Council. And so as a result, we saw that APEC, again, it allowed for that space for public and private to come together. And I think it really appreciated that that private sector is on the front lines, operating across 21 economies. And as a result, it's the private sector that can identify what are the friction points that are preventing economic growth, that are preventing innovation. And in that case, for instance, one of the early priorities that was identified was the need for regulatory convergence. And so I think that's a great model. So maybe one way to answer is, in some ways, I think we've taken the best of models that we've seen work. But I think in a way, with America's Health Coalition, or excuse me, with America's Rise for Health, Sarah, we've also been able to inject some pieces that are new and that are different. And I think here what is really exciting is that, to my knowledge, it is the only platform that is not only public or private, because as we just said, we have that in Asia, but I think what's different and is incredibly unique is that we are really, again, pulling in from the government perspective, not just the ministries of health, but also the ministries of finance, the ministries of commerce, ministries of trade, the procurement agency, which sometimes is its own entity. And so that, I think, is really, really exciting. And to my knowledge, that does not exist anywhere else.
That's great. Maybe if I can just add, and I'm mostly familiar with America's Rise for Health, although I've seen the great results from APEC, is, when you're in the room around that table and you see all these governments even sharing best practices and learning from each other, and all these different ministries learning from other stakeholders in the room, that is just so rewarding as well. So to your point, we won't agree on everything, but I think if we start with what's our shared health objective here and what's our shared challenge, I think we can really accomplish so much.
Well, on that note, Sarah, I think we are rounding up on time. I just want to thank you so much for your leadership, for MSD's incredible leadership. We have a lot more work to do, as you have articulated, but I think we now have, for the first time ever, this platform that really gives us that scaffolding, that infrastructure to work together in an organized way. And so for all of our audience out there, thank you for joining us. We hope that you will roll up your sleeves. And if you aren't already part of our community, we invite you to join us. You can check out our website, americasriseforhealth.org, or reach out to Sarah, reach out to myself, or the many, many partners that we have. And again, we save the date, March in Santiago, Chile. We look forward to seeing you there, and thank you so much again.
Thank you, Patty. Can't wait to Santiago, and thanks everyone for joining.